Hi, my name is Ray Shanahan, and I am the Director of Sales here at CareerCert. I've also been an EMT instructor for the past 7 years, and am here today to walk you through a quick demo of our newly introduced scenario-based courses. Before we start the demo, I thought we'd talk about some of the benefits of scenario-based training versus other training modalities. Scenario-based training is simply putting a first responder inside a scenario and asking them to make treatment decisions based on the information that they've been given. One of the benefits is the learner receives immediate targeted feedback based on their response. The second benefit is this is all done in a safe environment that has no true effect on a patient. But behind that, one of the other benefits of scenario-based learning is improving patient outcomes. If we can get a learner to go through a scenario, deliberately practice it in a safe environment, and give them the ability to do this multiple times, we are ultimately looking at providing a better patient outcome because they have already been through the skills piece and the critical thinking skills, more importantly, that goes into making a treatment decision in the field. Now that we have discussed the benefits of scenario-based courses, I'd like to take a few minutes and go through an actual course, giving you an idea of what the learner experiences in one of our scenario-based courses. So you'll see here that we've arrived on scene, and the learner is given some immediate feedback in their scene size up. As the learner advances through the class, they get even more feedback and information about what their partner has done. So in this case, we have gotten the patient's name, and we have placed a cervical collar on. As we continue to advance, the learner is now presented with 4 different assessment pieces to give them a better idea of what is going on scene. So if we click through each one of these, for check surroundings, we get an idea of what the scene looks like. We can walk through patient's history, an overall physical exam, and here we see that Frank's got bruising to his chest wall, pale and diaphoretic. And we're presented with this here. And what you'll see is the course is personalized, so it asks, Ray, you see this? The patient has pronounced JVD. We can even check our monitor, which in this case has been left in the ambulance. However, we can go through some patient assessment for lung sounds. We can go through whether the patient has a patent airway or not. We can get an idea of the patient's vital signs and how they're presenting. And we can do some auscultation and get an idea of what is going on in terms of breath sounds for the patient. In this case, they're absent on the right side and diminished on the left. This is meant to get the learner thinking about what they possibly could see in the coming minutes about this patient and making a treatment decision from there. So as we continue through the course, your partner turns to you and says, well, what do you think? What's your general impression? For the example of this demo, I'm going to walk through an incorrect decision to show you the feedback that the learner gets, and then ultimately go back and look at what the correct treatment decision would have been. So if I connect with stable, I get instant feedback that no way is this right, and maybe we should give this some thought. In this case, we made an incorrect treatment decision, but we automatically are getting targeted feedback around why. It tells us that the patient's clearly critical, and his MOI suggests a rapid transport, and he's also presenting with some very clear signs of shock. So in this case, we're being told it's best to stay on scene long enough to address any life threats, and then ultimately get the patient to definitive care at a trauma center. So now we can go back, select the correct answer of critical, And we get the feedback that, yes, he's definitely critical. Let's get him out of here. We're going to continue to advance through the scenario. Now we're faced with, okay, Ray, what do you want to do first? So here we're at a decision point where we need to pick from one of three different decisions. Again, if I select the incorrect treatment, we're going to get that targeted feedback right away. So let's go ahead and select assist ventilations with a BVM. We put the BVM on Frank's face, immediately begin to assist his ventilations. And lo and behold, Frank thinks that we are smothering him. His blood pressure continues to drop and he's rapidly deteriorating. Again, targeted feedback, absolutely not. Assisting with his ventilations is always going to make things worse. And in this case, due to he's got some hemodynamic compromise. Now we're presented with try again, which takes us back to the decision point that we were at before. And what I'd like to do now is select the correct answer of a needle decompression and show you what the learner experiences. So we suggest performing the needle decompression. Sandra finds her landmark, presses the needle in firmly. The patient winces a bit from the pain, but ultimately all the air rushes out of Frank's chest and he begins to breathe much better and is now able to maintain and protect his airway. And again, even when we answer the question correctly, we're presented with immediate feedback about what was going on with the patient. And in this case, it was a tension pneumothorax. Thank you for taking a few minutes today to review our newly introduced scenario-based courses. For further information, please visit us at CareerCert.com. And thank you for your time today.